for Thursday, August the 12th. There are no changes to the agenda. Could I have a motion to adopt the agenda?
This meeting is being recorded and or transcribed.
So moved. Second.
All in favor? Any opposed? Well, to say that we are concerned about the recent spike in COVID cases across our state would certainly be an understatement. I'm going to ask Jimmy Allgood, who is our Emergency Management Director, to come up first, and he has presented us a chart so that we can review where we are numbers-wise today.
Okay, good afternoon. Today, the state had its highest number of cases since this event began, and it was 4,412. The county number, we went up to a total of 6,960 cases, which is an increase of 37 new cases for today. I've got some additional data down here that you can look at. Our inoculation data, we've given in the past 4 days over 300 more vaccinations, 282 new vaccinations, and 89 second. From July the 15th to August the 11th, 98% of these new cases has been unvaccinated people. Only 2% have been crossover and have affected vaccinated.
Some data that I heard Dr. Dobbs present this morning. He said that Mississippi has seen a 151% rise in numbers of people admitted to the hospital with COVID in the last 14 days. And Mississippi is third in the nation in positive cases. As Jimmy said, the new record set today is the highest that it has been. The highest prior to today was on January the 8th, and our number today is almost 1,000 cases higher than that date of January the 8th. You know, we have maintained as a board that our actions would be driven by data, and that hospital occupancy or capacities would be what drove our steps as we move forward. And, you know, what scares me the most about these numbers is, as Jimmy has relayed to me and others, we have not peaked yet. So we are expecting to continue to see, especially if people don't get vaccinated, we are expecting to see these numbers grow. Our hospital is completely full. Our ICU is completely full. And we have said all along that maintaining our hospital so that beds are available when people have car accidents, when people have heart attacks, when people go into labor, all of those things, you know, our goal is to protect our hospital. And something that I heard another expert say this morning from UMMC, he said our hospitals across the state and the one in Oxford are full. The healthcare professionals are stating that if you look back a week or so at the number of new positive cases and rate of hospitalizations, if we continue on this trajectory for another week, then we could very well reach the failure of our hospital system. And he's talking about statewide. But I think that is, you know, that's what we have to look at. That's what we have maintained the entire time would be our measuring stick. And that for the wellness and health and safety of our community, I am asking you to consider to mandate for all of our city employees to wear masks, whether they are vaccinated or unvaccinated, and for masks to be required to enter city facilities. Any discussion or comments?
I think it's a good idea.
This is Brian. What is I get, and I've read, would it be a prudent consideration to consider a full mask mandate for at least some short period of time so we can possibly stem, and I know, I get it, I've read as much data as I can, and I understand the numbers as they go, and they're not going to go down, but at least we can do our part coming into with all the new students and whatnot, at least, and review it on a weekly or a bi-weekly basis. Is that something that I would at least encourage discussion about?
Sure. No, I think we definitely can. And I will tell you from my perspective, and anybody jump in, the last time that we had a citywide mask mandate, vaccinations were not available. And that was the key. We said that once vaccinations were readily available, that our goal was for citizens to be able to make those decisions themselves. Vaccinations are free. Vaccinations are readily available at Walmart, Kroger, Walgreens, most clinics. Baptist Memorial Hospital has a vaccination clinic. And I'm jumping ahead a little bit, but Jimmy and I are, and we won't give the details until after this, but we're working on pop-up vaccination clinics to be on the square and planning for those to be on Fridays of all home Ole Miss football games and other times. I do not like the idea of putting a mandate in place that we can't enforce. And I believe that we are at a time where our community and country have become so divided because these masks have become such a political thing, and they so shouldn't be. It hurts my heart that that's where we are, that taking care of your neighbors become political. But I believe that we would further divide our community right now if we put a citywide mask mandate in place. We saw the first time that, we had the people who are very anti-maskers and were very adamant, we're on that side of the fence. We have the others who feel very passionately about wearing masks, and we would get all the reports of, people don't have on a mask in this grocery store, send the police, we don't have the police in place to be able to effectively enforce a citywide mandate. That is for the board's discussion, but we had determined that if vaccines were readily available and free, that we would ask people to please get vaccinated. I know that is an emotional debate as well. And I know that each person will determine themselves whether vaccination is right for them or not, but will tell you that speaking with the administrator of our hospital today, that in the Baptist system, 97 to 98% of the people who are being hospitalized with COVID are unvaccinated. In the state of Mississippi, Dr. Dobbs said this morning that 85% of the COVID deaths in our state in the past 2 weeks were unvaccinated. Vaccination is the weapon that we have against this virus. Wearing masks, I believe, are critically important right now. The fact that I do not believe a citywide mask mandate is the right move is not a reflection of me not thinking that masks are one of our best weapons against it. And that's why I believe the school district is deciding for the schools if they wear a mask indoors, the university is deciding for the university, and I believe the city of Oxford, as we are running a business, decides for our employees and our facilities. But I believe that decision, left to other businesses to, and I hope businesses will follow suit. I know some will and some won't, and it's hard to do. But my reasoning, I think we have traveled that road before, and this board has taken a strong stance when it could be enforced and when there was no other way to protect our citizens. But with vaccinations readily available, that's, Brian, just kind of that's where our conversation has taken us over the past year and a half.
Sure, I understand. I just wanted to
Will you pull your mic down?
suggest it for discussion.
Absolutely. And the board can certainly all weigh in here.
So city employees wear masks even outside where they
No.
can social distance, or just inside?
Indoors or in crowded spaces. If they can space out outdoors, we don't expect the guys in the back of the garbage truck who
That's my
are 6
concern,
feet apart
especially
to
this
wear a
time of year.
mask. We don't expect the guys working water and sewer and street department and buildings and grounds and those on lawnmowers, we don't expect them to have on a mask working outside. But those inside, in offices, if you're sitting in your office by yourself, we don't expect you to have a mask on. We're being realistic and using common sense, but we do believe if you are meeting with anyone or if you're sitting at a desk where people pass by your desk or what have you, if you are inside a building, that's my recommendation, is that you have on a mask.
Or a vehicle.
Or if you're in a
multiple
vehicle with
individuals.
with someone. Riding in a vehicle by yourself, you don't have to have on a mask. Riding in a vehicle with another coworker, you should have on a mask.
How's that affect the House Center and Parks and Rec?
Same thing.
It would be the same thing. If you are in a city facility, you would need to have on a mask. Whether that's the Oxford Park Commission building or the conference center, or
Even while exercising?
that would be my proposal. For the next few weeks, I mean, we're at a point now at the hospital where every bed is full, and we have said, once that is the case, we are gonna, make hard decisions. So yes, in my opinion, kids have to have on masks at school. Kids, the Park Commission has been following that, and my recommendation would be yes, that if you're in a city building, you should have on a mask.
For the next 14 days, and then we review.
I would say we should review it at every board meeting, so next Tuesday, and then
And then
2
we
weeks
have-
later, and
We don't
then,
have one 2 weeks after.
and we can call a special meeting anytime any of you want to discuss it further, obviously, but, that's, during the first big wave, it was just a constant on every agenda that we had a COVID update and discuss the restrictions that were in place, and so I would, I've put it on the agenda for Tuesday already, and I believe that at every meeting, we need to revisit and make any alterations or changes. And certainly Jimmy and Bart and Braxton and I will be reviewing the numbers every morning, as we've done for almost 2 years now, so.
And we're tracking our 7-day average, so we can tell what each previous week. I've got the number for our 4-day average because we haven't made through this week's cycle yet, and our 4-day average of cases is at 43 on the chart, and we've still got 3 more days in this 7-day cycle. So we know it's going to increase, but that'll be a good indicator of when we hit that tipping point and we are on the way back down.
Right.
Jimmy, I remember when we were at 398 active cases. One thing that you can do is start getting the active cases again.
We can't.
We can't, they don't report it to us.
And people have asked us that, so I'll say it publicly, why are y'all not keeping up all these charts that you had through the first round of COVID? That's because all of that data was provided to our emergency management director by the State Department of Health, and they provided it to him on a daily basis, and he updated our charts. We no longer receive that information, so that's why it is not updated. We receive new cases
That's
daily.
it. New cases.
And what they do is they give us our new total, so we subtract, figure out what that means for this day, and some days we get it, and some days we don't, and then they'll send us a number and say, over the past 3 days, this was your increase, or what have you. So we have not stopped reporting the data that we have, we just aren't getting the same data this go round.
That's correct.
And I may have said this earlier, I've said it so many times today, but the hospital data is not reported on the State Department of Health site because there would be no reason. Every room is full.
Correct. They have,
Statewide.
as of Monday, the State Health Department quit reporting the state hospital data. So actually, the mayor is talking with Bill Henning every day, getting our local update for us.
Okay. Brian, I think where I am on this is, with the vaccinations available, I think it's individual businesses' choices to require a mask or not require a mask. I know mine will require a mask in entering our building. I don't think at this time, like the mayor said, a mask mandate would be hard to enforce, but I think we need to rely on those that are unvaccinated to really look at the data that 98% of the new cases are unvaccinated cases, and that just shows you that the vaccine, for the most part, is working. And I would encourage, if you're not vaccinated, please go get vaccinated. I'm vaccinated twice, my wife is, and we're about to get our son, who just turned 12, we're gonna get him vaccinated. So that's one thing I would encourage, but as far as a mask mandate, I think we mandated in the city buildings and for our city employees at this time.
Yeah, I was thinking since you're gonna have this in 2 weeks, and with the hospital all over the state is being filled right now.
That's right.
If we could just level put a citywide mask back in for 2 weeks and see what it drops, because we're up now. And if it goes down, it's something gonna have to be, it's constant up.
It is. That is the board's pleasure. Keisha, Brian, do y'all have anything else to add?
No, no.
Keisha?
No.
I have one question for Seth on the activity center. What activities is masking gonna basically eliminate? I mean, pickleball, what is going on in the next 2 weeks that?
All right, so I met with the staff earlier when we come out of department head. We put restrictions, we're ready to release restrictions for any of our programs. We won't cancel anything. We're looking to move as many programs as we can into the new facilities so we can shut the old facility down. The Oxford Activity Center, shut it down at 5 o'clock every day. We're going to lock every door to the activity centers and push people to one specific door at each place, so they'll have to have their mask on to get in and participate in any activity. We'll have staff at each door, manning those doors to allow people to come in to have masks. But as far as us having to cancel anything, we won't have to cancel anything, but it'll be individuals to choose whether or not they want to come in and exercise with a mask on or mask off. That's
Okay.
what we're prepared to do right now.
Okay, thank you.
And I will say, John Morgan emailed me, and he is out of town today, but wanted me to state that he is not for masks for people who are vaccinated, only unvaccinated. So I'd forgotten to say that.
Well, you talk about difficulty in enforcing, that's almost impossible.
Just reporting my email.
Robin, Robin, if I may ask,
Yeah.
do we know have you had any conversations with Home Depot, Walmart, the bigger box stores about what they plan to do, or are they going to follow suit of the city?
We have not, I've not had any direct conversations with any of our big box stores. I have seen Walmart's announcement that they required their employees, and I believe Home Depot did the same thing in requiring, I may be misspeaking there, but I believe Home Depot did as well, require all of their employees to be masked. And I saw an announcement on Twitter, so it must be true, right? But I saw an announcement on Twitter that Walmart was going to require everyone, even guests in their store, to begin wearing a mask, but I don't know the date.
I was actually at Walmart at lunch, and they do have a sign on their doors that say that they recommend masks for everyone, and they did have someone there at the door handing out masks if you wanted one.
Yep, and they have definitely put all of their associates back in masks. I'm not sure about
Yeah.
Home Depot, but Walmart definitely has, and a few other chains have, some of the fast food chains in places like that.
That even though we don't call businesses essential or non-essential, I've noticed for the last week that what we would consider an essential store, the groceries, the hardware, box stores, et cetera, do have employees in masks.
And I can
that
look and find
recommendation.
out, like on the larger stores, what their corporate policy is, because it'll be online, like Kroger.
Well, and you know, I would say that probably one of the biggest mistakes we made first go around, and believe you me, we know we didn't get everything right. We made the best decisions we could make with the information that was in front of us that day, and that's all we can do again. But I'd say that probably one of the biggest, if I could go back and change something specifically, it was determining that businesses were essential and non-essential. We took that lead from the federal level and went with it and spent so much time deciding, but I can guarantee you as a small business owner myself that any business that you're expecting to pay for your rent and your food and take care of your family and your employees' families is essential. So I hate that we ever identified as essential and non-essential, and you won't see us do it again. But that's right, hindsight's 20/20. That was that's something that I would certainly do different this time, and we will. But I do believe that you will see businesses across our community do the right thing, in my opinion, which is ask people to wear a mask indoors. I believe that our community saw it work the first time. They saw us get through this the first time. I hate a mask. Can't stand it. It frustrates me to have to ask people to do it again. I know that there are contradictory reports on masks and types of masks, and people can email me all the articles again. I've seen them. But, all I know is this. I'm an art major. I'm not an epidemiologist or a virologist. I can't argue with you the scientific facts of masking. What I can tell you for me, and I hope for a lot of other people in our community, is if the minor inconvenience of wearing a mask protects me or protects somebody else, then to me it's worth it. So I'm asking our community to join us in whatever this board decides, to get vaccinated and wear masks. I think that it's critical to our success as we move through this second wave. We've got about 15,000 new citizens moving in as we speak. And I want it to be a great semester for them and for our community and for our economy to keep going strong as it is right now. But in order for those things to happen, people are going to have to get vaccinated and people are going to have to wear masks indoors, or we'll end up back where we were, where nobody wants to be. So I will leave it up to this board to make whatever motion you would like to make.
I'll make the motion that we require masks in city buildings and require all city employees to wear masks unless they are outside or by themselves in social distancing area.
I'll second that.
All right, any other comments or questions? All right, all those in favor?
Aye.
Any opposed? All right, that is our, you want to?
You got one other thing.
Yeah, the emergency declaration.
Well, the MOU,
Oh,
Memorandum
that's right.
of
for the-
Understanding.
Yeah. Okay, yeah, sorry, I'm losing my whole outline here. We have talked about doing the pop-up vaccination site, so give us an update, Jimmy, on that.
I've just got through meeting with one of the local clinics and everything, and they're gonna come on board and do the one-day pop-up site. We're gonna have our first one next week. We'll announce the time and the dates, and then they're on board with Friday before every home game. We'll also set up next door here at the plaza and the old RSVP site and do them every Friday. We think the MOU may not be necessary since they want to step in and do this and everything, but just in case they have to miss a day, the health department said they would backfill on those days, on those
Great.
Fridays, football Fridays, if they needed to and everything, and that's what the MOU as far as just it's a memorandum of understanding with the state health department that they're gonna provide the services and provide a one-day pop-up vaccination site.
Wonderful. And also, Jimmy is working on, with the State Department of Health, we understand that there are very few places that get free testing anymore for COVID. And so we are working on, the State Health Department is going to set up a station here somewhere where you can, they haven't determined the location yet, but hopefully in the coming week, they will have a site established to get free testing. Because that's the other thing that's key to keeping it from spreading, is people knowing that they've got it so that they can quarantine. So we will be working on that. So I guess we need a motion then to allow me, with council's approval, to sign an MOU to allow for the pop-up vaccination site to be on city property.
So move.
Second?
All in favor?
Aye.
Any opposed?
Aye.
And we are really excited that Governor Reeves this afternoon, I'm gonna get this wrong, but signed,
Extended
or
the-
extended the emergency declaration so that, for 30 days. And we're very thankful for that, because that allows us to apply for FEMA funds for any response that we have for these pop-up sites, for the masks and hand sanitizer and all of the different things that we will be distributing again. So, any other comments? Well, the booster shots are not CDC recommended yet, and not FDA approved, so I have heard that some clinics are giving those, but I don't have any data on that, nor,
That'll be
I
part
don't
of-
think it's
that'll be-
recommended widely.
That'll be part of our announcement when we announce the one-day sites.
Okay,
Okay,
great.
perfect.
All right, anything else, Mr. Taylor? Keisha or Brian?
Nothing for Brian.
All right, we have considered an executive session, which we do not need to have today, but I would ask for a motion to adjourn.
So move.
Second?
All in favor?
Aye.
Any opposed? Thank you.